Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How much do your organs weigh? Organ weight is a complex subject. There are many factors including body weight, height, lean body mass, and race that cause organ weights to vary widely. /r/n/r/n to figure out accurate ranges for organ weights, more data need to be collected. Furthermore, this data needs to come from different types of people. Right now, such data are not routinely collected. /r/n/r/n organ weights used for reference need to come from forensic autopsies, which are usually performed in cases of suspicious, sudden, or traumatic death where a dead person's organs are otherwise healthy. /r/n/r/n diseased organs assessed during hospital autopsies shouldn't be used to determine reference values because the disease can actually affect the weight of an organ. Furthermore, the number of autopsies performed is plummeting, giving researchers fewer opportunities to access and assess organ weights. /r/n/r/n despite being poorly appreciated and minimally researched, organ weights and sizes are still used by healthcare professionals to determine the cause of death and disease and to guide certain treatments. /r/n/r/n in 2001. French researcher Grand Maison and co-authors published a paper in Forensic Science International analyzing organ weights from 684 autopsies performed on whites between 1987 and 1991. /r/n/r/n This study's power and concordance with other studies of organ weight, as well as a lack of research on the subject altogether, make it as good a source as any to calculate organ weights. /r/n/r/n Based on the results of this study, the following are mean organ weights and ranges for men and women. /r/n/r/n organ /r/n/r/n average weight in men, grams /r/n/r/n range in men, grams /r/n/r/n average weight in women, grams /r/n/r/n range in women. Grams /r/n/r/n heart /r/n/r/n 365 /r/n/r/n 9630 /r/n/r/n 312 /r/n/r/n 174 590 /r/n/r/n liver /r/n/r/n 1677 /r/n/r/n 672,900 /r/n/r/n 1475 /r/n/r/n 508 3081 /r/n/r/n pancreas /r/n/r/n 144 /r/n/r/n 65 243 /r/n/r/n 122 /r/n/r/n 6250 /r/n/r/n right lungs /r/n/r/n 663 /r/n/r/n 201,593 /r/n/r/n 546 /r/n/r/n 1 173 1700 /r/n/r/n left lung /r/n/r/n 583 /r/n/r/n 206 1718 /r/n/r/n 467 /r/n/r/n 178 1350 /r/n/r/n right kidney /r/n/r/n 162 /r/n/r/n 53 320 /r/n/r/n 135 /r/n/r/n 55 360 /r/n/r/n left kidney /r/n/r/n 160 /r/n/r/n 5410 /r/n/r/n 136 /r/n/r/n 4300 /r/n/r/n spleen /r/n/r/n 156 /r/n/r/n 3580 /r/n/r/n 140 /r/n/r/n 33481 /r/n/r/n thyroid /r/n/r/n 25 /r/n/r/n 1287 /r/n/r/n 20 /r/n/r/n 568 /r/n/r/n to some extent. These values lack generalizability and can't automatically be applied to all people in a population. Even though humans change very slowly over time, the results of this study are already dated. /r/n/r/n in the purest sense, breasts aren't organs per se, but rather a collection of mammary glands and ducts, connective tissue, and fat. Nevertheless, the breasts are a distinct enough entity from the rest of the body that many surgeons who specialize in breast surgery consider them anatomic organs. /r/n/r/n researchers have estimated, based on their assessment, that a pair of female breasts weigh about 3.5% of total body fat weight. However, the sample size of the study was small and the results are dated. /r/n/r/n according to the formula, a woman who carries 40 pounds of total body fat would have breasts that weigh about 1.4 pounds for the pair. /r/n/r/n breast weight is very variable, says Dr. Bradford Sue, a general surgeon affiliated with Sharp Healthcare in Chula Vista, California. Depending on the age and development of the person involved, both breasts combined can weigh as little as 100 grams, 3.5 ounces, or up to 4 or 5 kilograms, about 9 to 11 pounds. /r/n/r/n Furthermore, histological changes in the composition of the breasts can sometimes affect breast weight. If someone has a lot of fibrocystic diseases, says Dr. Patricia Allenby, a pathologist at The Ohio State University, the breast is going to be heavier than if it's fattier. It has to do with the density of the tissue, and fat is very low density. /r/n/r/n However, the effect of fibrocystic, adenomatous, or tumorigenic changes on breast weight is relative. /r/n/r/n If you have a small, golf ball-sized tumor in a small breast, says Sue, that tumor takes up more of the breast than it does in somebody who has a very large breast. In one person, that tumor may represent a third of her breast mass, and in another person, that tumor may represent less than 1% of her breast mass. /r/n/r/n. Besides disease, another important factor that affects breast mass is diet and exercise. When people lose weight, they tend to do so uniformly. /r/n/r/n. For example, if a pear-shaped woman were to lose weight, she would still retain her pear shape but at a smaller mass. She would be proportionately smaller. /r/n/r/n. Women don't lose a higher proportion of body weight from one specific body part like the breasts after engaging in diet and exercise. Targeted fat loss or spot reduction is unlikely. /r/n/r/n. A woman who loses weight will not experience a noticeable decrease in breast size. Her breasts would be appropriate for her new weight and in proportion with the rest of her body everything would just be smaller. /r/n/r/n. Numerous factors may affect organ weights, including height, body mass index, BMI, diet, age, and sex. /r/n/r/n. Research indicates that people who are taller, weigh more, and have more lean body mass may have heavier organs. /r/n/r/n. Height. Of these factors, some research suggests that height may best correlate with most organ weights. Taller people have organs that weigh more and are proportionately bigger. /r/n/r/n. BMI. Heart size can be significantly affected by BMI, with obese people having larger hearts. One study showed that people with obesity, BMI 30, have larger kidneys, liver, and pancreas. /r/n/r/n. Diet. Interestingly, female thyroid weight has little to do with height, weight, and lean body mass. Instead, female thyroid weight may be most influenced by dietary iodine intake. In areas where the vast majority of women consume enough iodine, thyroid weights typically fall within a uniform range for all women. /r/n/r/n. Sex. On average, women tend to have lighter organs than men do. /r/n/r/n. Age. Except for the heart, organ weights tend to decrease as we get older. Age-related decreases in organ weight are particularly noticeable in brain mass. In other words, a person's brain will become smaller as they age, which is a natural process. On a related note, brain mass has nothing to do with intelligence. Having a bigger brain doesn't make someone smarter. /r/n/r/n. Brain weight can also vary based on the population being studied. For example, one study found the mean brain weight was 1,322 grams for a Caucasian male and 1,221 grams for a Caucasian female. Another study of 232 males aged 18 to 35 had a brain weight ranging from 1,070 grams to 1,767 grams. /r/n/r/n. One physical parameter that exerts an unclear effect on organ weight is obesity. Obesity is an epidemic in the United States and rising rates are undermining the credibility of organ weight reference values. /r/n/r/n. Certain pathology sources express organ weights as a percentage of body weight, defining a direct and proportional relationship. /r/n/r/n. Dr. Allenby points out the flaw in organ weight calculations based on body weight. Your organs don't increase in weight as much as your body weight does. If someone's body weight doubles, the organ doesn't double in weight. /r/n/r/n. It should probably come as no surprise that the effect of disease or pathology on organ weight is highly variable and complex. Certain illnesses cause organs to weigh more and certain illnesses cause organs to weigh less. /r/n/r/n. Chronic alcohol use is associated with an increased size of the heart, cardiomegaly, and an increased size of the liver, hepatomegaly. Eventually, however, liver weight in people dependent on alcohol can decrease with the development of cirrhosis. With cirrhosis, healthy liver tissue is replaced with scar tissue. /r/n/r/n. A 2016 study suggests that people with type 1 diabetes experience substantial decreases in pancreatic weight when diagnosed. People with type 2 diabetes, however, don't experience a decrease in pancreas weight. /r/n/r/n. As for the brain, cerebral atrophy seen in conditions such as stroke and dementia results in decreased brain weight. /r/n/r/n. There is still a lot to learn about organ weights. Currently, the reference values used for organ weights aren't based on convincing evidence and aren't universal. /r/n/r/n. Investment in such research is important because the size and weight of organs are factors used to determine health status and cause of death. /r/n/r/n. Organ weights help us to determine if there is an abnormality, says Allenby, and a lot of diseases are related to size changes, especially in the heart. Organ weight helps us to confirm or correlate the diseases that are present. It helps with diagnosis. /r/n/r/n. Looking forward, non-invasive imaging modalities, such as MRI and CT, may prove useful in determining organ weights without the need for an autopsy. /r/n/r/n. Researchers in a 2006 study found that the weight of the liver and the spleen can be estimated using imaging data and volume analyzing software. In fact, the researchers suggest that such imaging may be more accurate than autopsy at determining liver and spleen weights in the case of congestion, shock, since no changes in intrahepatic blood volume occur during imaging. /r/n/r/n. They also predict more promise in the use of CT to determine organ weights. CT is less expensive and easier to use than MRI, and purification of gases and embolized air caught in the blood vessels of the circulatory system, limit the use of MRI. /r/n/r/n. The skin, which accounts for around 16% of a person's total body weight. /r/n/r/n. The liver is widely regarded as the heaviest organ inside the body. /r/n/r/n. Organs can become larger and heavier, known as organomegaly, as a result of certain diseases and conditions, such as colon. /r/n/r/n/r/n/r/n/r/n/r/n. Thank you, form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.